Round two.
Round two.
Oh, it's recording.
According to the National Autism Association, autism is a bioneurological developmental disability. It is the fastest growing disability in the United States, affecting 1 in every 59 children, which means we come across a child every single day with possible autism. It is usually found with conditions such as attention deficit hyperactive disorder, obsessive compulsive disorder, sensory integration dysfunction, and neuroinflammation. It is often compared to a scale ranging from almost unnoticeable to severe, to the point where the child or patient cannot be left alone. The current medical treatments for autism consist of medical treatments, medical therapies such as physical therapy, emotional and fear therapy, and sometimes psychiatric therapy, antipsychotic medication, sometimes medically requested restraints, and deep brain stimulation, which is not yet FDA approved. According to an article in Spectrum magazine, the first case of deep brain stimulation for autism was used on a 13-year-old boy from Germany with a multitude of disabilities, such as he was diagnosed with autism, mental retardation, cerebral palsy, and self-injurious behavior. When the researchers at the University of Cologne chose to try this aggressive treatment with him, they had tried everything else to no prevail. The target during the surgery was the amygdala within the boy's brain, which is the part of the brain that controls fear and emotion, to try to get this self-injurious behavior under control. In the end, the results were better than as expected. Within the first 10 months, the boy had said his first words, responded to external stimuli, and began responding to his parents, teachers, and everyone else. Other recent trials have shown similar successes. According to the FDA, deep brain stimulation is approved for the treatment of OCD and severe epilepsy. It works by attaching electrodes to the patient's brain and stimulating the part of the brain that is misfiring, which is typically the amygdala. It is also attached to a device in the chest similar to a pacemaker, where the doctor can change the electricity rate with a small device outside the body. Through these trials, deep brain stimulation has proven to decrease the severity of many problematic autism symptoms and is currently in the process of being tested by the FDA as a treatment for autism. In the case of the 13-year-old boy, he showed an improved quality of life by reduced self-injury, the ability to communicate with his peers, and the ability to respond to external stimuli. A similar case with a 19-year-old girl resulted in less self-injury and the ability to control her impulses. The use of deep brain stimulation in autism patients could be the best possible treatment for severe autism. As I briefly mentioned before, autism is the fastest growing disability in the United States, and if medicine and science can come together to create a new effective treatment for autism, there really is hope for all these autistic children in the world. Thank you.
No, don't do it again.
Sorry, it was a little creepy.